Hi everybody, hope this finds you well. I'll start as I normally do with a bit of information about our COVID numbers and our response, and then I'm going to talk a bit about staff testing and the work we've been doing with partners across Lanarkshire, and then finally I'll say a bit about staff wellbeing and also the rollout of the iMatter staff survey this year. So starting with the numbers of inpatients are currently 48 across Lanarkshire, so it has trended down, although it has plateaued slightly over recent days. So the main new cases that we're seeing are within the younger cohorts of our population, which is good. So these people are generally not being admitted in the way that we've seen in the past, so that has to be a good thing, but we're not out of the woods yet. Within ICU today we have 3 patients and 5 patients on CPAP, and care home outbreaks, 6 care homes with live outbreaks at the moment, and we will be looking to target care homes early in the booster vaccination programme to see if we can control that a bit better going forward. Individuals who've been vaccinated, 495,000 and 916 doses now administered. Sadly, we have seen a bit of aggression from patients recently across a range of services really in relation to vaccination, but also within our front doors, and staff recently did put out a video just to kind of say this is the sort of thing we do experience and it's not to be tolerated, and I would absolutely support them in that. When people access our health services, they should treat people in the way that they would expect to be treated themselves, and if you go by that, you're not going to go far wrong. And it is absolutely unacceptable to be aggressive and, dare I say, sometimes violent to staff. And we have had to bring in police recently on occasion to our emergency departments. That again is not something that I would normally expect. So I know people are anxious, I know people are still worried, and it's been a difficult time, and sometimes that can come out in unfortunate behaviours, particularly when somebody's unwell. However, please encourage people just to respect each other within all departments of the hospitals and our community services as well. Secondly, obviously that can have an impact on wellbeing of staff, and again we'd encourage all of our staff to access those wellbeing supports. We have put additional wellbeing supports into our A&Es over recent weeks just to support staff who we know are really busy in these departments. But again, a whole range of supports available for staff. We have the staff hubs within the acute sites, but all staff have access to psychological support, and obviously refer people to occupational health where necessary. You can self-refer or your manager can refer you. I wanted to say just a wee bit about testing. Testing is one of the things that will help us as we move forward to live with COVID over the next 12 to 18 months. We've done some work across Lanarkshire with our partners, so that is fire, police and the 2 local authorities, to pull together a toolkit that staff can look at and employers can use to keep staff safe through regular testing. So I'd encourage you to have a wee look at that. We do test already, our frontline staff, and in fact all staff now have access to regular testing twice a week, and I would encourage you to do the testing. It's one way that you can keep yourself and others safer. So for example, if you are meeting up with friends and family, why not ask them to do a lateral flow test first? It's one thing that can help you going into that situation to be a little bit more confident about the security of yourself and your loved ones. Finally, I just wanted to say a few words about the iMatter staff survey. So from this week, staff within the corporate directorates will start to receive their questionnaires, and I would urge you to fill these in and make sure that we do get a good response, because your feedback enables us to take action on things that you feel need looking at. So we'll do that in partnership with you, but really important that you do spend just a few minutes filling in these questionnaires. Can I just say thank you for all your efforts in looking after our staff, and look after each other. Thank you.